Okay, good morning and welcome to the annual review of the Golden Jubilee Hospital. My name is Alec Neil. I'm here in my capacity as the Cabinet Secretary for Health and Wellbeing. And the purpose of today's review is to look at how progress is being made in the Golden Jubilee in terms of achieving its targets, primarily its clinical targets, but also looking at the performance of the overall organisation, including the financial performance. And it's an opportunity for members of the public to hold the board to account for their performance over the last year, but also an opportunity to look forward to the year and years to come. Can I say already this morning I've had a meeting with the Partnership Forum, I've had an excellent presentation from 4 clinicians, and I've had a very good meeting with representatives from the patients, all of whom report excellent service in the Golden Jubilee, but also identified areas where we could improve the quality of service provision. And that, of course, is the purpose of the annual review and all the meetings that are around the annual review, so that we can look at progress, but also get the feedback from the patients who are at the centre of everything we do, to identify their perception of how well things are going and their suggestions of how we can make further improvements. After this session, the public session, I will then be meeting the board, because the way this was done previously, there was actually no direct meeting between the Cabinet Secretary and the board, and I'm keen particularly to hear from the non-executive directors of the board about their perception of how things are going and also their plans for the future. And that will be informed by any feedback we get today. Now, the format this morning is, this is primarily you holding the board to account. So I'm shortly going to hand over to Jean Freeman as chair of the board, and Jean and Jill will then give you a presentation, and then we'll open it up to questions and comments from you, the audience. We do have some questions we've received through Facebook and Twitter, and we'll do our best to answer those as well. So this is very much your meeting, your opportunity, and I now hand you over to Jean, Chair of the Golden Jubilee Board.
No, I've got it. Thank you very much, Cabinet Secretary, and can I also extend my thanks to all of you for taking the time. As the Cabinet Secretary said, for those of you who don't know me, I'm Jean Freeman, the Chair of the Board, and beside me is Jill Young, our Chief Executive. Can I also introduce Ben Newton-Wiley-Black, who is kindly signing for us this morning, and thanks to Ben for coming along to do that. We're going to show you a short video presentation which encapsulates some of our achievements and results for the year that's under review, and then I have a short slide presentation to pick up on some of the others. After that, as the Cabinet Secretary said, I'm going to work through the questions that have been submitted through social media, and then turn to you to see if you have any questions of your own that you want to ask before we conclude this morning. So I should also point out that we have a comms team here that knows their chair exceptionally well, and knows for a fact that I cannot walk and chew gum at the same time. So I have a lovely assistant who's actually going to make the video work for me, and will then make the slides work for me. For those of you who don't know me, trust me, this is saving you a lot of grief and me a lot of anxiety.
Welcome to the Golden Jubilee National Hospital. As an NHS Scotland National Board, we are very proud and extremely privileged to be home to a major orthopaedic centre of excellence, to a growing and significant ophthalmic unit, and to one of the largest heart and lung centres in the UK.
2013-14 was a very challenging but very successful year for us. We started the year intending to treat 23,500 patients. As we went through the year, we were asked to increase our orthopaedic, ophthalmology and MRI programmes. We increased those services as we went through the year, and as a result exceeded our full year plan by 14.7%. This means that we treated 3,500 more patients than we intended at the beginning of the year. We're looking to establish outreach clinics for a number of boards, and at this point in time we've already committed to 3 outreach clinics.
Yeah, well, it's been an extremely busy year for us. We are at the moment expanding the service. We have a 500% increase in the amount of work that we're being asked to do compared with 2011, 2012. So at the moment we're innovating in terms of how we utilise staff, how we spread the staff out throughout a department. Well, moving forward, first we are going to expand the outpatient department to cope with the huge increase in the number of patients that we're being asked to see over the next 2 years.
Our HEI agenda is very clearly set out within the plan programme for the prevention and control of infection, and we met our targets, we met our programme for last year. We work very closely with the local teams to look at their data and build and improve and sustain improvement. We use infection data, but because our infection rates are so low, we tend to focus more on compliance data because we focus more on prevention. So we use the kind of data in terms of national patient safety, standard infection control precautions data, and also hand hygiene data. So we'll continue to work with the Scottish Patient Safety Programme, we'll continue to look at standard infection control precautions and also the implementation of the National Manual and Transmission-Based Precautions.
I am very pleased to report that the board has achieved all of its 3 key financial targets for the year 2013-14. It's been a very challenging but very interesting year. In terms of numbers, we generated efficiency savings of approximately 3.6 million against a target of 2.6 million. We absolutely continue to deliver quality improvements across the organisation, working within a very tight financial envelope.
We've carried out a number of energy initiatives over the years. We've just started on a decentralisation programme, the intention of which is to remove the steam infrastructure and replace it with low temp hot water. And this in itself will save perhaps 15% annually on gas consumption, and it will have a very positive impact on our carbon footprint. Now, we are looking at a number of innovative solutions, one of which is to take advantage of the fact that we're so close to the Clyde and possibly install a water-sourced heat pump.
Our board's 2020 vision is to lead quality research and innovation, and to do that on behalf of our board here, but importantly on behalf of NHS Scotland. 3 distinct elements, all of them equally important. We believe all need to be taken forward in parallel, and they are all interdependent. You can't do one without the other. So the first of those elements, governance. Governance for quality. The second element, our workforce, but not just any workforce, a values-based workforce. You should be able to walk into any department or ward and see it. If you're a patient and you're in for care, every contact, every part of that care process, you should feel it. And when I wake up in the morning, a member of staff, heading to work, I should believe it. So the third element are quality indicators. So reviewed all of the quality indicators, made sure that each of them could have a measure against safe, effective and person-centred, and that they added value to our organisation and the safety of our patients. Safety is never compromised.
The thing that I did really notice was that the staff are extremely happy, and that also is to do with the environment of the hospital. I mean, you've got this beautiful scenery here as well, which helps a lot. And I was asking a young chap today, I says, do you enjoy working here at the hospital? He says, I love it. And that is really nice to hear, because that doesn't, that reflects back on the patients. If your staff are happy, the patients are happy.
I came into the Jubilee with cardiac arrest while playing football. I then went to Dumfries Infirmary and got transferred up here to get an ICD fitted. The staff have been great at the Golden Jubilee. Everyone's been really accommodating. They've been trying to help me through it mentally as well as physically. All the nurses are very helpful. They come in and check me periodically. I couldn't complain, everything's great.
And as part of the National Care Programme, we have focused our work on making some improvements. One of them is with a review of our quality patient and public group. Part of that work has been around reviewing that the role and responsibilities for that group does indeed help us to ensure that we get the best use for our patients and for service users.
Our Board Diversity Champion programme was first launched in 2012, and it's proven really successful. And following a recent evaluation, we've actually added to our champion role now, and that's totalling 30 champions. And they play a vital role in helping to promote our equality and diversity work at their own department level.
We were delighted to be given the opportunity to be one of the pilot boards for the NHS Scotland Staff Experience Programme, and in fact over 300 of our staff in 18 teams actually was involved in developing the national programme, and we're going to be one of the early adopters in terms of the iMatters implementation rollout plan later this year. In terms of team effectiveness, we were successful in securing a bid from the Scottish Government and the Dignity at Work funding, whereby we will be able to do a lot of work to look at how we can support teams and enhancing team effectiveness.
Our reputation and communicating with patients and members of the public is vitally important, and that's why I'm really pleased that last year 97% of the people that we interacted with had a positive experience. And that's a positive experience through things such as social media, the media itself, patient opinion, our website and emails.
The Beardmore Centre for Health Science has two main components. It's got the clinical research facility and it's got the clinical skills facility. So the clinical skills facility is a suite of purpose-built educational rooms that includes a simulator room, facilities for doing wet labs, and most importantly perhaps the facility to make live links with theatres, cath labs and radiology so that we can watch live patient demonstrations, and that includes a two-way audio link which allows interactive use of these. So if we think a bit about management of adverse incidents always occur in all systems. And the important thing is to learn from them and to feed that learning into continuous improvement. And we've done a lot of work looking at our own processes so that they're lined up with the national framework for HIS. We've reviewed our risk management processes this year, and that started up with a top-down approach. So we've reviewed the board risk register, looking at our actual risks and our processes for handling risk. And the audit committee will continue to take that work forwards during the course of this year.
So over the past year, the research activity has continued to focus on finding new ways to improve recovery after heart attack and also after heart bypass surgery, and also to look at enhanced recovery after the type of major orthopaedic surgery that goes on at the Golden Jubilee. The biggest thing that will happen over the next couple of years is that we have taken on a sponsor role for a major multi-centre European study looking at a new type of coronary stent for patients who have lesions, narrowings in the main heart arteries.
Well, this is the Beardmore Hotel and Conference Centre, and we're a very integral part of NHS Scotland, and we work very closely with the Golden Jubilee Hospital. We have about 52% of our customers are from the NHS, public sector or the third sector. We do have roughly about 43,000 delegates a year, mainly, as I say, NHS Scotland, public sector.
We've had a fantastic 12 months, including an improvement in our GTBS green accreditation, where we're re-evaluated and achieved our gold status, but also with an improved score, so we improved to 86%. In addition to that, we also had the inclusion of car charging points.
The Beardmore 2020 strategy was an extensive piece of work to identify an optimal future for the Hotel and Conference Centre as an integral part of the National Waiting Time Centre. It was decided that our strategy would be to be the hospitality and conferencing element of a board-wide strategy to create an innovative centre of excellence for healthcare and medicine.
This is our brand new innovation centre. It's to encourage innovation, it's to provide a high-tech environment that inspires staff to have new ideas. Innovation is us supporting you to take your idea into improving patient care. And we would hope that this brand new centre provides that link to our hospital, to our research centre and to the hotel here for the benefit of all our patients. It's also vitally important for us to share this innovation resource and our skills and expertise across the whole of Scotland, and indeed that's exactly what this centre is for.
Thank you very much. I hope you found that short video interesting and useful, and I know that you should have had on your seats a short outline of some of the slides and some of the information that we've just listened to, but also some of the information I'm going to go through now. I want to just briefly capture some of the key elements of our performance, and I'm going to do that under the 3 quality ambition headings of person-centred, safe and effective. The first of those is person-centred. A couple of key things to draw your attention to is the number of complaints that we received in the year 2013-14 was less than 0.1% of patient activity. Nonetheless, for us, learning from complaints and from issues that patients and others raise with us before they become complaints is critical to us. We've, as the Cabinet Secretary said, heard some of those issues raised with us this morning, and that is important to us because our objective, one of many as an organisation, is to continuously improve in what we do. The results from our part of the NHS Scotland staff survey in 2013 showed that 92% of our staff are happy to, as we would say, go that extra mile at work, and I think many of our patients reflect back on us the impact, the positive impact in their experience that produces, and that 88% of our staff are clear about their duties and their responsibilities. In any organisation, those of us who work in organisations know how important it is that we know what we're here to do, and we also then know that that is valued. And part of that valuing, I think, is reflected in our sickness absence, with an absence rate in the year 13-14 of 3.6%, one of the lowest in the public sector. Moving on to safe, it is the case that we put a great deal of emphasis on a safe and low infection environment and look continuously to improve on that, because bugs are innovative wee things in their own right and are constantly mutating and coming up with new challenges for us. So it's not an area where you can be at all complacent even when your results are very good. So our healthcare associated infection rate remains achieving lower rates than national targets. Our SABS incidence is 0.17 cases per 1,000 in our acute occupied bed days. In addition, in terms of SAFE, the Innovation Centre, which was mentioned in that video, was opened in July of this year and does produce state-of-the-art facilities to promote innovation, research and learning, all of which goes to produce safe, effective and person-centred patient care, not just here, but for the health service across Scotland and with growing numbers of international connections. And we were very pleased indeed when the Cabinet Secretary announced that we would host the new Health and Social Care Innovation Fund, a fund of a significant order specifically there to promote innovation and improvement in the health service in Scotland, but also to provide that vital link between what happens in healthcare here, in other countries, and how the private sector and academia can cooperate to advance both clinical learning but also quality care for patients. Moving on, also still I think I missed one there. Oh no, I didn't. Moving on in terms of effective. Effective is more than making sure that the books balance, although Julie, our finance director, always wants to make sure that we do that too, and I know that John is particularly keen that we achieve that target, and we do. But effective is also about the volume of work that we put through the hospital and continue to do that with those low infection rates and those safe clinical outcomes. So in 2013, we exceeded the activity target in inpatient day case and diagnostic procedures by 14.7%. That's a considerable additional volume. We saw major growth in orthopaedics, ophthalmology and diagnostics. 55% of our orthopaedic patients were dealt with on a see and treat basis, which is an approach that we pioneered and certainly smooths the path of the patient journey and makes the patient experience much more manageable, effective and results focused. We saw in 2 years, since 2011 and 12, a 342% increase in ophthalmology work and diagnostic imaging increasing over our plan by 20%. I need to pause at that point really and just let us absorb what that volume of increase actually means and take the time to thank all of the staff involved throughout the organisation, clinicians, housekeeping staff, booking staff, our executive directors, our reception staff, portering staff. Every single person is involved in allowing us to not only meet our targets but to exceed them, and we exceed them because that is the demand that the health service has, patients have in Scotland for that, and it's a privilege for us to be able to meet not only that planned expectation for this board but also to exceed that. But that at the end of the day is down to every single person that works here and their efforts and their commitment. A short slide there showing the increase in our hip and knee replacements for the health service in Scotland since 2003-04 and where we expect to be in this current year, 14-15, where we estimate that we will be undertaking 25%, so a quarter of all hip and knee replacements for the health service in Scotland. Again, a similar graph showing the increase in the cataract operations that we've undertaken here since 2011-12, and our expectation that by 2015, or in this current year, we will be undertaking 12% of all cataract operations in Scotland. And for anyone who has either had that operation, conducts it, or sees the end result of it, you know the dramatic improvement that a successful cataract operation can have on the quality of the patient's life and the way in which they're able to get an enjoyable and productive and active life back by what is an important operation for them. In terms of our regional and national services, because so far we've looked at our elective work, but our regional and national services play a large part in the work that we do here at Golden Jubilee in Beardmore. All of our heart and lung patients were treated within the national target, which includes the 31-day cancer heat standard. We were very grateful indeed. The Cabinet Secretary joined us in order to mark the fact that we are the UK leaders in fastest treatment times for angioplasty, door-to-balloon time as it is known. That is quite an achievement. It has taken a lot of small improvements that have been of themselves innovative, but cumulatively make a significant difference to the patients affected. Delivered a 185% increase in heart transplants over 4 years, a 70% increase in referrals to the pulmonary vascular unit in 5 years. We continue our implementation of the SAC strategy, and the lung cancer resection rates increasing from 10 to 15% over 5 years does make a significant improvement to survival rates for patients affected. Our last slide is really, as you would expect at Golden Jubilee, we are pleased with the results that we have achieved so far. Very grateful indeed, as I've said, to all the staff who work in Golden Jubilee and in the Beardmore, every single one of whom has contributed to those results. But we always are looking to the future. The important thing always is to improve quality and be innovative and continue to strive for an effective and productive patient journey. So looking briefly at where we intend to be and our future opportunities, it was mentioned in the video by Jill about the quality framework and dashboards. It's a clever IT thing. That's as best as you're going to get from me by way of an explanation. It's a clever IT thing. The important bit, though, about it is it allows us to, at every single level, from ward level right through to board level, to be able to interrogate our performance and identify areas where we can improve on quality and improve on safety. And by having it structured in that way that it works from ward level right through, it means that our staff are empowered themselves to identify where improvements can be made and to act on those improvements. And so it's embedding the whole notion of quality, improvement and safety throughout the organisation. We will take on our lead role for innovation in the health service in Scotland, particularly with our responsibility for that fund. We intend to create a new surgical day unit and increase day of surgery admissions, to extend our 7-day working, and with particular thanks to our rehabilitation and pharmacy staff for their redesign of their own work and their own patterns in order to assist us to do that. We expect to see an increased use of technology in telehealth and telemedicine, which allows us to work effectively with patients throughout Scotland, particularly those in remote and rural areas, and would expect to see further expansion of our services in order to meet that demand across the health service in Scotland and benefit patients in the future, as we have been doing in the past. That said, Cabinet Secretary, I think we can now move on to some of the questions that we've been asked. As I said, I'm going to take those that came to us through social media first, and then obviously turn to yourselves. And there may be in some of those questions, Cabinet Secretary, where you might want to say a few words yourself. So the first question comes from, now these are all Twitter ones, so I'm going to have to read out their Twitter, whatever it is. What is it you have on Twitter? I've got one, but it's how you're known. So the first is from HMN001, and the question is, when are we getting an A&E for the northwest of the city? New Southern, Glasgow Royal and Royal Alexandra, all too far away. Now, obviously at Golden Jubilee, we're very pleased when patients and potential patients recognise the quality of care, but that is not a decision that sits with me or anyone in Golden Jubilee. I don't know, Cabinet Secretary, if you'd like to say anything.
Yeah, I'm happy to say, as people will probably know, there is a clinical services review going on for the north of the River Clyde, and obviously once I receive that review we'll be looking at it, because obviously if there are recommendations for legal service reconfiguration they can be approved by me in any case, but I am very, very conscious of the strongly held view north of the river in relation to the provision of accident and emergency services, and the view that existing arrangements are unsatisfactory because of the distance that people have to travel. We'll have that very much in mind when we look at any proposals coming out of the review, and we'll consult widely before we make final decisions and before we implement the recommendations or a variation of the recommendations coming out of that review. But I am very, very conscious of the issues around this.
Thank you. Our next question is from Drea F8, and it is, the Vale of Leven report is due to be released shortly. Is this likely to impact on the Golden Jubilee National Hospital? I would guess there are perhaps two components to that question, and I'll ask Jill to deal with the first part, and again, Cabinet Secretary might want to say a word.
Absolutely will impact on the Golden Jubilee in terms of any report that comes out about patient safety and improving quality of care. You may recall the Mid-Staffordshire report that came out and other reports that have highlighted failings in some hospital services. So any recommendation from any report, and this would be one, that when it's published, our senior team will take it and review it and look at all of the recommendations and lessons learned. We take that through our clinical governance committee, we'll talk to our clinical teams about it, and we'll take recommendations to our board on any areas that we are not complying with or that we could improve on. So absolutely it should impact on every hospital around the country, this report, and take it forward. The second aspect to the answer would be about if the report then highlights if there's anything we can do here practically in terms of delivering of services to assist in moving forward, then of course we would welcome that discussion and going forward.
Okay, as you probably know, this report is going to be published in the week beginning the 24th of November by Lord McLean, who has led the inquiry. I have not yet seen any draft or any copy of the report, so I honestly do not know what is in it. I expect to get a draft a week before it is published. But obviously we will take very, very seriously both the conclusions and the recommendations arising from the report. And of course, we've already implemented very substantial improvements, particularly in relation to health-acquired infection control, right across the National Health Service in Scotland. Since these incidents happened at the Vale of Leven, for example, we have massively expanded the National Patient Safety Programme. We've massively reduced the incidence of both MRSA and C. diff, and we've made other major improvements across the entire health service in Scotland, including in and around the Vale of Leven and this part of the west coast of Scotland. But obviously the report will, I am sure, make a number of recommendations, and we obviously will take those very seriously with a view to implementing them once we see the detail.
Thank you. Our next question comes from the same person, and it asks, could you also tell me if there are any future expansion plans for the Golden Jubilee? So I touched on that briefly, but Jill, could you answer that, please?
Yeah. We get asked this all the time. Last year we celebrated our 10th year anniversary in the NHS, and I've been here from almost day one, as many of the staff in the audience probably have as well. We have not had 1 month or 1 year where we have not expanded, and we will continue to do that, but do it safely and do it at high quality. And that doesn't always mean you need additional buildings and capacity. Sometimes it does, and that's when we come to people like John Conahan with really robust business cases and look for some funding to support it. But at the moment we're just about to commence our phase 4 of orthopaedic expansion next month, and recruitment of staff to take that forward and do many more hip and knee joint replacements. We're about to commence our next phase of ophthalmology expansion. We have, if any of you entered through the hotel entrance, you would have seen a mobile MRI scanner, and we're looking to expand how many diagnostic examinations we can do. And over the next month or 6 weeks, we're about to take on board an extra few thousand patient operations on behalf of Orkney, Shetland, Grampian and Highland to help them through the winter and the high peak demands in orthopaedics, ophthalmology and some of the diagnostic. So I think we should always be looking to expand and always looking to do more, as long as the demand is there and we can provide that capacity.
Thanks very much. Our next question comes from David Thompson, and he asks, are there any plans for using stem cells to treat patients at the Golden Jubilee? So let me deal with that. We're currently running a trial called the CATCH-AMI trial, which examines stem cell applications for treating heart disease, and in fact are the largest recruiters in the world for that trial, and the second trial will be starting very soon in the near future. We're also hosting a basic hip arthroplasty course, which will include a session looking at the use of stem cells in terms of preserving joints. So I think it's fair to say that we recognise the potential value of the use of stem cells in the work that we do here at Golden Jubilee, and are engaged in that research and those trials to test out the validity of its use in certain circumstances and the potential safe implementation of that. Our next question comes from Mary Hemphill, and it's a Facebook question, and it is to ask what plans for patient participation within the SAC service, including volunteer work and patient group support for our inspiring patient community. She also goes on to say, I'm sure many patients would welcome the opportunity to share experience and life stories to help support others. And certainly it is true that our SACS patient community is a mutually supportive and a very well informed community. Over the past year, we've continued to host SACS patient conference days, and also have had patient representation on the regional implementation project, which is part of the SACS network. We would be looking as we go forward to involve patients in helping us develop the SACS section of the Golden Jubilee website so that we can be sure that it is fit for purpose and has not only ease of access but the kind of information on it that patients would find most useful and helpful, and are also having a look now with our patients with long-term conditions about web applications to assist them in continuing management of their own care and their own knowledge of that care. Many of our patients, including our SACS patients, follow what we are doing through our use of social media, Twitter and Facebook and so on. And we will continue to look and seek their feedback in order to ensure that we can maximise the benefit of that for them, but also to welcome their suggestions, but suggestions from any of our patient groups or users of our social media about how we can improve how we use that so that they can get the maximum benefit from those communication channels, which are particularly important for our patient group in its widest sense, who do not come from an easily accessible locality to us. They come from across the entire country of Scotland. And lastly, our final question in this social media section, if you like, is from Brian Bradley, again via Facebook. And his question is, with just under half of the patients referred to the new TAVI centre in Edinburgh since October 2012 actually receiving TAVI, is this an indication that the centre is being overwhelmed? And if so, are there any plans to extend this service? And how many TAVI experienced interventional cardiologists are currently based at the Golden Jubilee? So I'm going to ask Jill to answer that last part of the question about the number of TAVI experienced interventional cardiologists, and then Cabinet Secretary, I'll come to you. Yeah. Jill.
We currently have 3 consultants trained and skilled for this intervention. 2 are cardiologists and 1 is actually a heart transplant and cardiac surgeon, and they're maintaining their skills by going through to work with the team in Lothian, but also to go down south to centres down south that do this to keep their skills up to speed. We could quickly bring other clinicians on board if there was a requirement for that, but it would require them having a refresher training programme. So we have 3 at the moment.
Can I just say nationally, the throughput of patients at the moment is around 60 per year. We had anticipated that it would be over 100 by this time, and we're looking and talking to health boards throughout Scotland to find out why the demand for the service isn't as high as originally predicted by them, and what needs to be done to stimulate the demand, because we're absolutely sure there are many patients who would benefit from TAVI who are not currently being referred to the service. Obviously, originally we anticipated, because of the additional throughput we anticipated, then by now we had expected to appoint a second centre other than Lothian in the West Coast, which obviously I think would have been the Golden Jubilee, but we don't have the throughput at the moment to justify a second centre. But obviously, once Aileen Keele, the Acting Chief Medical Officer, has done her survey and finished her discussions with the health boards throughout Scotland on this matter, we will update people in terms of what she has found out and what the way forward is in terms of improving the throughput figures, assuming the demand is actually there, and secondly, if there is sufficient demand, whether we need a second centre and when we might need a second centre, if we need a second centre.
Thanks very much. Thank you. So thanks to everyone who submitted questions through social media. It's now your turn. And so if you do have a question, just indicate. We've got a roving mic, a roving Simon. So please, are there any questions? Don't feel obliged, but if you have them. We'll take the lady first and then the gent beside you.
It's a very simple question. What's TAVI?
It's a really complicated clinical thing, and the medical director is sitting right in front of you and will tell you.
So it's a way of putting a heart valve which sits on the aorta, which is the main valve out of the heart. But instead of doing heart surgery, so you open up your chest, close the heart, and put the valve physically into the heart, you feed the valve in through an artery in the leg that follows from inside the vascular system. So there's no need for an open operation. And if it goes well, patients can be at home within 2 or 3 days. And it's a minimally invasive form of surgery.
And the gentleman sitting next to you also had a question.
No. How many heart transplant operations took place in the past year?
19 last. Our target was 11, and we were delighted to exceed that target of 19 with very good outcomes. Very good outcomes.
Any other questions? If not, can I, for my part, on behalf of the board, thank you very much for taking the time to be here this morning, and pass over to you, Cabinet Secretary, for any final words.
Again, thank you very much indeed. I should have introduced John Conahan, who's our Director of Performance in the Scottish Government. We're now going to have a meeting with the board where we'll go into some of the more detailed review of performance and financial performance as well. But can I just say I'm, as always, extremely impressed by the progress made at the Golden Jubilee and by the fantastic quality and excellence of the services provided, including the research work that is going on that we had a presentation on this morning. It really is not just leading edge in terms of Scotland, it's leading edge in terms of the UK, and indeed some of it is leading edge globally. This is a fantastic asset for the National Health Service in Scotland, and more importantly for the people of Scotland. And while there is always room for improvement, as a number of the patients indicated this morning, while they made very, very good suggestions, they were all at pains to point out that their experience in the Golden Jubilee has been absolutely fantastic, with the quality of support they've had. The staff have been absolutely outstanding, and I would like to take the opportunity to congratulate the board, congratulate the senior management team, and congratulate every member of staff and every volunteer who works in the Golden Jubilee. I think you're all entitled to be very, very proud of the work that this organisation does. Thank you.